Do you leave every doctor's appointment with more prescriptions and referrals and also more questions? Oh, friend, you're in the right place. I'm Kayla, registered nurse and personal medical strategist, and here every week we're going to work together to cut through the noise, connect the dots, and finally get you the real plan you deserve. Let's dive in. When I was in nursing school, we were taught that as long as you are doing the right thing by the patient, that you're caring, that you're working hard, and that you're following safety protocols and procedures, that you're good. And if something happens, the system will have your back because sometimes bad things happen. And as long as your intentions are in the right place, you're safe. And that makes sense. That is the way that things should be. But it's not the way that it is. And I learned that the hard way. The truth is, almost every part of modern healthcare runs on the same model. Doesn't matter where we're talking about, a hospital, an outpatient clinic, a surgery center. The system is built on efficiency. The faster people move through it, the better the numbers come out at the end. You see, insurance doesn't, obviously insurance pays for almost everything that happens in healthcare. And insurance does not reimburse based on how many hours it takes to take care of someone. They reimburse a fixed amount. It doesn't matter if it takes 1 hour or 5 hours or 10 days. The facility is going to get the same amount of money. This is exactly why you see your providers stretched way too thin, why you only get 15 minutes with your doctor, and why everything seems so rushed. Because every minute that a nurse or a doctor spends double checking or explaining or slowing down becomes a cost that the C-suite at the top makes sure we want to avoid. I saw it so many times. People being sent home before they were ready or to situations that didn't seem safe. Honestly, a lot of times I convinced myself I was overthinking it or that maybe I was just being too paranoid or too cautious. But there was one time I just could not go along with the plan. I didn't raise my voice or cause a scene. I calmly went to the person in charge and told them my concerns about this potential discharge situation. They told me to discharge anyway. I I refused. I said respectfully, I can't do that. This is wildly unsafe. I will not have my name tied to something that is so wildly unsafe. Like there were no other words to describe this situation that this person was going to. Um, Before I knew it, that patient was no longer my patient. They were reassigned to another individual who was more complicit than I. That person was sent home, and the I found out shortly thereafter that the exact fears that I had came true. I wasn't paranoid. I wasn't overthinking. I was keeping patient safety front and center. And for that individual, it didn't matter. They ended up in the hospital in far worse condition than what they had even been in the first time. But the story gets worse because when nurses like me, the ones who speak up, we're seen as a risk to the process, a risk to the bottom line, a risk to the profitable conveyor belt of care that doesn't want to slow down. And what do you think happens in a system like that when it identifies a threat? I was fired very shortly after. And of course, they couldn't fire me for standing up for a patient. That would look too bad. So to their credit, they got very creative. and combed deeply through my professional and personal life, found the tiniest scrap of an infraction, blew it out of proportion, big enough to create a paper thin justification for immediate termination. It was wildly disorienting, to say the least. It shook me, but it also, I ended up being grateful for it because it really opened my eyes. The rose-colored glasses were absolutely shattered at that point. That was probably one of the moments that I think that's when I started saying that, working in healthcare is not like they put on the nursing school brochures. Now, you might be thinking, okay, that's awful, but that was just one bad manager at one messed up place, right? That's what I thought for a while. I I have I have a tendency for bad luck, so I just assumed it was my bad luck peering its ugly head. But then I started hearing from other nurses, and it was not too long after that I somehow reconnected on Facebook with a nurse that I had used to work with at another location, and this individual had been taking patient safety concerns to leadership for over a year, and at first, they started just giving him bad shifts, nights, weekends, holidays, making his published schedule, completely different than the days that he had signed up for, that kind of thing. That went on for, I think, about a year or a year and a half. And then finally, this individual was working in an emergency department in a triage setting. So if you've ever gone to the emergency department, the first clinician you see is the triage nurse. They check you out and then they decide if you get a room now, if you go back to the waiting room, if we start some sort of tests. So he was in that role, and he was following protocols and triaged somebody out to the waiting room who ended up having a medical emergency. It was one of those things where, despite best intentions, sometimes freak things happened. And on paper, they looked completely stable, but then something happened, and they had a poor outcome. And he was immediately terminated. I'm pretty sure leadership was also looking for something that they could justifiably pin a termination on. Then, as I got into my advocacy career, I connected with another nurse who echoed very similar stories of retaliation against nurses who spoke out. And she actually works in advocacy for nurses and has interviewed dozens of nurses who tell similar stories of getting fired in the name of patient safety. The takeaway that I want you to have here is that this is not a one off. This isn't bad luck for me, because hospitals and other healthcare entities, obviously they need the staff to keep working for them. And the fact of the matter is, we need jobs too. Nurses need jobs too, and doctors, and they have their livelihoods are on the line whenever they're considering how hard they're going to press for patient safety. And most just can't walk away. They've got kids, mortgages, student loans. Unfortunately, a lot of these places, hospitals and whatnot, typically the pay is better, and the hours, 12-hour shifts are hard, but it's also sometimes that works for people's scheduling. So it's not as easy as just walk away and find another job. So they say quiet, keep your head down, and do the best you can in a broken system. And that is honestly the reality that every healthcare worker is in, period. That is the reality of every healthcare worker who is taking care of you. They are stretched too thin and trying their best But at the end of the day, like I do not know a single nurse who has been a nurse for more than a few months. I don't know a single one who hasn't had a shift where they have broken down in the bathroom or somewhere crying because they know that they cannot take care of everything assigned to them in as high of a level of quality as they would want to. So, this isn't just my story. This is a spotlight on what happens when you have a healthcare system that prioritizes efficiency and revenue over patient safety. It is happening everywhere. When I got fired, it was not because I failed. It was because I refused to fail a patient. That is the truth that most people outside of the system don't see. Most people think that hospitals are well-controlled, hyper-safe environments, but it's just sadly they're not. They're machines. The whole thing runs on time and money. Think of it like an assembly line. Every delay, every extra minute a nurse spends double checking meds or answering patients' questions costs money. And when margins are tight, safety becomes negotiable. Not for me, but for the people who write the policies that dictate the kinds of conditions that your clinicians have to work under. This is why you see your clinicians who seem rushed or distracted. They're not careless. They're trapped in a system that demands speed. And every time they try to slow down, they risk their job. So if even the good ones can't always protect you, what do you do? How do you keep yourself safe in a system like that? Well, here's what I teach my clients. Number one, never go alone. Always have another person with you, a friend or family member, or ideally, an independent professional advocate. When you're a patient, you're vulnerable and you need somebody whose only job is to pay attention. Number two, ask questions early, not later. If something feels off, bring it up before the IV is in or the anesthesia starts. Once things are rolling, it is much harder to stop the train. The phrase really is so true. An ounce of prevention is worth a pound of cure. Sometimes the cure can't even be delivered. Number three, trust but verify. One of my favorite phrases. You can and you should be trusting your care team's intentions. If you don't trust your care team, especially your doctor, you need to find another one. You need to be able to trust them. Your life is in their hands, but you still need to double check the details. Ask things like, has anyone reviewed my medication list for interactions? And don't take the answer of, oh yeah, that's somebody's job. Actually get a more clear answer than that. And if you can't, continue to escalate that. Or who's responsible for my discharge plan? Or if you have a concern that it seems like somebody hasn't taken into consideration, like special circumstances in your living situation or certain disabilities that you may have that perhaps aren't being taken into consideration, voice them. Never assume that somebody has already thought about it, considered it, and then deemed it safe. That's probably the number one assumption that I have seen cause harm to patients is the thought crossed their mind that because of their specific situation, something might not be safe, but they assumed that their doctors and nurses already had taken it into consideration and felt that it was safe regardless. Don't have that blind, implicit trust. Number four, know your safety lifeline. Every hospital and most outpatient centers have a way to escalate care if you think something is wrong. Sometimes it's called a rapid response or a patient safety hotline. Find out what it is when you go into the facility before you need it. You'd rather have and not need than need and not have. Number five, pay attention to how the staff are acting. If you see nurses, techs, and doctors who look stressed, frazzled, or like they're rushing, that is a sign of overload, and you should have your antennas tuned in on high. Do your best to slow down the moment with calm, clear questions. Always stay calm, cool, and collected, which ironically is so difficult when you are in these circumstances. That is why have somebody with you, ideally somebody trained in this kind of environment, because it makes all the difference in ensuring a safe outcome. Slow down the moment with these calm, direct questions and to give everyone the breathing room to make sure it's right. I have to tell you, it makes such a difference when the request to pause and reevaluate comes from the patient and or their family and visitors as opposed to from the nurse. When it comes from the nurse to the doctor, um, it's much more likely to be dismissed and or just not pursued as intensely as if it comes from the patient and the nurse to the doctor. That makes it a lot more harder, a lot more difficult to ignore. Um, the other unfortunate part of this math that you have to remember, um, I honestly, in that situation, when I was standing up for that patient, I had no idea that it would end up costing my job. I literally never would have imagined that. It just seemed too unreal. It seemed too unreal to me. I trusted and believed too much in the goodness of humans and what we were doing in healthcare. I didn't see the wolf in sheep's clothing at that time. Um, but it's a force that is underpinning every interaction that you're having. And even for me, it was still uncomfortable to step out and speak so boldly. It wasn't the first time I've been in a situation like that. It was the only time I got fired for it. But there's been several times where I've had to kind of go toe to toe with physicians. And then the thing is, obviously it paid off for those patients in those times, but then those patients, they come and they go. And I still have my job where I have to continue working with these physicians. Now, in a tense dynamic has been created. For me, patient safety is my ultimate priority, and I am somebody who I I can separate feelings and do my job. Not everybody is wired that way. In fact, I would say most people are not. This is another piece of the dynamic that I have seen play out. That even the when a nurse, and I say nurse because they are often the person who is in between the patient and the physician, when the nurse has to choose between pushing harder on behalf of, let's be honest, a total stranger, or maintaining a working relationship with a colleague and job stability, which one of those forces do you think is going to prevail? It should be the patient. And it also shouldn't be so damn hard to advocate effectively for what our patients need. But in the real world, that math ain't mathin'. I I hate to have to say it like that, but the fact is you need to know. And I don't hear these conversations very often outside of hospital walls, outside of between healthcare workers, but it's impacting you. So just know that those dynamics are going on behind the curtain that you're not seeing. And let's talk money for a second because that's the real elephant in the room. Hospitals know that most people don't choose where they go. Over 70% of hospital visits are unplanned. So even if patients have terrible experiences, they're still going to come back. They don't have a choice. And that is why profit can take priority over safety, because when there's no competition, there's also no accountability. Here's another thing you may not know. Medical malpractice is actually really difficult and expensive to prove. And hospitals know that if you have a bad outcome or your loved one dies because of negligence or overburdened providers, it's probably not going to affect the hospital at all. Isn't that disgusting? But that's the math that's going on up at the top when these decisions and policies are being made to overwork your providers thinner and thinner to be able to generate higher and higher profit margins. Hospitals quietly accept a certain amount of harm as inevitable and then rebrand it as these things just happen sometime. But it's not inevitable if you know how to create a pause and ask the right questions. Every shortcut in healthcare that saves a dollar costs a person something. That's the math that no one talks about that you need to know. Getting fired that day felt awful and it shook me, but it also woke me up. And it was the beginning of realizing that I couldn't fix the system, that these problems were way bigger than me, and it wasn't going to get fixed from the outside. Honestly, it was one of the first seeds that was sown to help me move away into creating Herd for Life and everything that I am doing now. We're here to make sure that you don't fall through the cracks in the system because we don't get paid by the hospital. We're not concerned with their bottom line. We're concerned with you. And we get to stop at nothing to protect you. Ignorance is bliss until it gets you hurt. You don't have to know everything, but you do have to pay attention. Ask questions, bring backup, and if something doesn't feel right, trust that. Because blind trust may keep the system comfortable, but it is not what keeps you safe. Don't you go to another appointment unprepared. Head on over to herdforlife.com/guide and get my free doctor's appointment prep guide so you can start getting the answers you need and get off the medical merry-go-round. I'll see you next week.